friends, and good morning, good afternoon for the people joining from other part of the world. My name is Shrenik Shah. I'm from Ahmedabad, and I'm stage 4 vocal cord cancer survivor. Currently in my 27th year, and patient advocate and moderator on behalf of Indian Cancer Society, Delhi. Now, before I introduce our esteemed guest, let me mention what exactly ICS is. ICS means innovation. They have brought me as a speaker and a moderator of this event, and of late, lot of informations are being shared on the web browsers, etc. And we are bringing top of the line cancer specialists across one India for sharing their knowledge, expertise, experience, and so on. And today, I am super excited to introduce our wonderful and esteemed guest speaker, Dr. Anuja Deshmukh. She is a head neck cancer specialist surgeon from Tata Memorial, Mumbai. And friends, you know very well, Tata Memorial, Mumbai doesn't need any kind of introduction. And she is heading the department of head neck cancer. Welcome, Dr. Anuja, madam, and the stage is all yours now.
Thank you very much, Mr. Shah, for the opportunity and inviting me here. Just wanted to tell you that I'm at Head and Neck Oncology Department, and I've been here for last 15 years. And I hope I would like to give the information regarding the head and neck cancers. And it will be not much of the theoretical part, but how we see in Tata Hospital the head and neck cancers and what we should avoid and what is the role of tobacco in this head and neck cancer. And greeting to you all from Tata Hospital. So I'll go ahead with my speech. So what is the cancer? So it is an uncontrolled abnormal cell growth. It is called as cancer, which starts invading the surrounding part of the body and then it spreads to the other organs. Cancer can start in any organ or tissue of the body, and cancer is the second leading cause of the death globally. So 1 in 6 or estimated 10 million deaths are due to the cancers, and 1/3 of the deaths are related to tobacco. So if you look at the data about Indian data, which has been shown in 2022 about the Globocan data, that we will see 1,113,316 new cases in this year. And number of deaths, as you can see, it is 916,000. So looking at our total population of 1 billion, we are seeing so many cases. And if you look at this diagram, if you see the most top one is the lip cancer in the males, what we see it, and in females, the breast and the other cancers are there. But we are the number one in the lip cancer and oral cancer. Again, that comes in head and neck. Coming to the next thing, if you see the world data about the lip and oral cancers, the Asian, the Indian among them comes the first top one as a cancer, which is actually unfortunate part about that. And we see so many cases of the lip and oral cancers. So what are these type of cancers? So the cancer can be called as carcinoma, sarcoma, leukemia, lymphomas, multiple myeloma, melanoma. They all are different type of cancer depending what is the origin of the cancer. So what we see in head and neck is the most common one is the first one, that is the carcinoma, and which is the epithelial cell origin, that is the squamous cell carcinoma, which we see it most common in head and neck area. So in head and neck area, the cancer is very, very complex. Complex because it is next to our food pipe and it is very next to our windpipe. And that's why the functional morbidity because of this cancer is too much. Even the cosmetic problems are too much because it affects our voice, it affects our mandible bone, and therefore it is very difficult to reconstruct. So, what is the cause for all this? So, cause is this, which is very well known to everyone that we know that these all things are bad, but most of the times we don't pay attention. So, we know the known factors like tobacco, supari, alcohol, sharp teeth, or any trauma also can cause a denture, ill fitting, can cause a cancer. Apart from that, unhealthy diet, any viruses, environmental factors, radiation, immunosuppression, and genetically you can have a cancer. So, what are the facts regarding tobacco? 50% of the smoker die. 15% of the worldwide deaths are due to tobacco. As I already mentioned, 10 million deaths are due to tobacco. And there are 8 lakhs deaths per year. And 1.3 lakh due to second-hand smoke. Means they are not actually smoking, but somebody in their family or surrounding or friends, they are smoking because of their respect. And among the 5 young adults use tobacco. So young people are getting very easy access to tobacco and they are consuming it. So this data is really bad for cancer, bad for them, bad for our country. So that's why there is something called as a tobacco day, that is 31st May. It started in way back by WHO and it draws the attention to the tobacco, basically people, how they are causing a tobacco epidemic and preventable death about this tobacco, how we can prevent it and how it causes head and neck cancer. That is the main theme of this World Tobacco Day. And the theme for this year is protecting children from tobacco industry interference. Why so? Because if you know that the children are getting exposed to tobacco and they are our future generation, and if they are going to get involved with tobacco, then we are not going to have a healthy future for our next generation. So that is one point to be noted. So what are these effects on body? So it damages our lungs by mainly causing lots of pulmonary diseases like asthma, bronchitis, and lung cancer. There is a chances of 25% risk related with the lung cancer. It can cause a problem with the heart because it causes atherosclerosis. There is a plaque in the blood vessel, or it can cause a problem with the narrowing of a blood vessels in the legs and the arms. It causes clots, premature deaths also it causes because of the effect. It causes a fertility issues in females, in males, congenital problems in the babies, not conceiving baby. All these problems can arise because of this smoking. It can cause diabetes, it can weaken our immune system, it can weaken our eyes, oral hygiene, it can affect our skin, nail, hair, digestive system, it can affect our CNS system, that is the neurological system, blood pressure, it causes osteoporosis, it causes delayed wound healing if you get any wound or any surgery. So all these problems are because of this smoking. Apart from that, there are various cancers are attributed to tobacco, that is 30%. 90% of the head and neck cancer, the oral cancer or a voice box cancer, throat cancer are related with that. Lung cancer, pancreatic cancer, the bladder cancer, stomach cancer, you name it and it is there. Even the blood cancer, that is leukemia, can happen because of the tobacco. Coming to the word about the second hand smoke, what I was talking, that it is also linked with the throat and the breast cancer, leukemias. The spouses have a twice risk of developing lung cancers, and many children of this second hand smoke can cause asthma, lung diseases, ear problem, even the death syndromes can happen. Third hand smoke is another one. which lingers around on the surfaces of the object and which can also cause a problem to the small babies. The skin absorption can happen because of that. So third hand smoke apart from the second hand smoke is a concern. Just a word about that. Coming to the just a part about the e-cigarette, it is a device which delivers the nicotine for the user, and it still consists of a harmful chemical which can cause lung diseases, and it is highly addictive, and it is not safer than the smoking. So there are many places e-cigarette is banned and it is not allowed. So just a point about that, e-cigarette is not a safe cigarette. So coming back to the head and neck cancer sites, so there are various subsites like oral and the lip, or pharynx cancer, that is a nasopharynx, or behind the tongue side, and the hypopharynx food pipe area, or a voice box area, that is the larynx area, a nasal area, or a sinuses, or a salivary gland tumors like a parotid, submandibular gland, and the sublingual gland, or a small glands in the oral cavity. You can have a cancer. So, what are these? So, in head and neck cancer, you can have a potentially malignant disorder. That is, you can have a white patch in the oral cavity, or a red patch, or a lichen planus, or a submucous fibrosis. So, these are potentially malignant disorder. They can get converted into a cancer, or they can remain like that and can cause a problem. So, I draw your attention. If you get something like this, you have to seek and see the doctors and show the appropriate doctors so that they can act on it. So these are the few photographs I'm going to share to you, so that this will help you that what is bad for your body. Anything which is abnormal, which is not normal, is a problem in oral cavity. So this is a white patch. This is very obvious that you can't ignore this. The next is the again a thin patches. If you can see in the inner side of the cheek next to the teeth, you can see this white kind of a verrucous kind of a lesion here on the tongue, on the bone. This is the tongue part. So you can see these are the lesions which are not normal. There is a red patch here, a small red patch. So you can understand that these are the things which should bring the patient to the doctor. They should not come late to the clinic. Apart from that, you can see there is a white patch on the tongue, red patch on the tongue, and this is the verrucous lesion on the inner aspect of the cheek, and this is the lesion over the under surface of the tongue in the mouth. So all this is called as potentially malignant disorders. Apart from that, there is something called as a submucous fibrosis, where you can see the mouth opening has been reduced tremendously, and it is causing a problem for a patient to open the mouth because the patient was a chronic user of a gutka. So this causes a problem for the patient. So I urge everybody, gutka is not that it is without any harmful effect. All harmful effects are there, and that can cause a cancer. So please be aware that gutka is not just a mere entertainment so that you can have it like how you chew a groundnut. Coming to the lip cancer, if you can see, this is a florid cancer in a different variety, right? From the small size to the big size, you can see this is called as a lip cancer, where you can see ulceration. The next one is the buccal mucosa, the inside part of the thing. You can see a fleshy thing. You can make out that this is the cancer in the advanced stage. This is little bit early, but yes, it is still in the second, third stage of the cancer. Coming to the tongue cancer, you can get an ulcer like this small tongue cancer in the initial stage, which can be just seen as a proliferative lesion, or because of the sharp teeth, you can get a trauma and you feel that it is nothing but it's a just a ulcer because of the tooth, but you need to seek help for this, and you need to see the doctor for this. This is another small lesion on the inside part, which is a very tiny lesion on here and next to the tooth, but yes, it is a cancer. So you need to see doctors so that we can do a small surgery or a small treatment so that you can be all right with that. Again, this is the another cancer called as a palatal cancer, or you can have a neck node in the um, which is palpable to your hand just below the mandible. And these are also early signs of cancer. When you get a neck node, that means the tumor has gone to the third stage. So remember all these photographs. These photographs are not to scare you, but these photographs are shared so that you know that you need to see the doctor as early as is possible. This is the another thing where this is the photograph taken with the endoscope. This is the voice box of uh, where it is showing a small lesion. It is not seen to us, but just to tell you that if there is a change of voice, that means there is a cancer of the voice box if it is a long standing. So coming to the different stages, if it is a stage 1, you have a 5-year survival, or the survival from the cancer is very very high. But as you go from stage 1, 2, 3, 4, the survival drops down to 45. And most of our patients come to the medical advices or a treatment in a stage 3 and stage 4. They don't come in the early stage. So I urge everybody to seek medical advices whenever they see an abnormal thing. They should not wait for one month. Otherwise, tumor will progress from stage 1 to stage 3 and stage 4, and then we can't do much for the patient. So what we do is a multidisciplinary approach to this cancer. We all sit together, the plastic surgeon, the radiation department, the medical department, the chemotherapy, physiotherapy, dentist, and we treat this cancer. So we do offer a surgery or a radiation or some kind of a treatment in an injection form like chemotherapy, immunotherapy, or a targeted therapy, depending on what is appropriate for that stage and that particular subsite of the cancer. So coming to the reconstruction part, when we do surgery, we do sometime only a closure of, we remove the tumor and close it primarily, or we use some skin grafting inside. Or sometime what we do is we do a free flap or a pedicle flap. That is, we take a flap from the chest and put it in the oral cavity, and that's how it looks after the surgery. It's all good when we remove this tumor from the, and we might take a sometime the part of the mandible also. So we do many surgeries so that the patient is comfortable after the surgery. Sometimes we remove the part of the mandible and the tumor, and we put a bone from the leg, and that's how it looks at the end of the surgery. So it is very good. If the patient closes his mouth, you can't even make out that patient underwent such a big surgery. Or sometime when you do a middle part of the bone is removed, the patient might look like as a Andy Gum deformity, a famous cartoon character. But if we put the bone instead of just closing it like that, the patient a form is maintained and patient can chew, talk, and various things he can do it. So remember, there is a lots of advances has happened in a reconstruction part. So they take a bone from the leg and they put it here, and that's how you replace the bone which is turned into a cancerous segment in the middle part of the mandible. So if you look at the reconstruction, this is the patient whose tongue was resected, and the flap was taken from the hand and it has put here, and this is the normal tongue shape has been maintained. This is the entire tongue has been removed, and the flap has been taken from thigh as well, put in the thing. This is the patient with the advanced lip cancer with again a flap has been taken from the hand and it has put. So you can achieve a good goal, but you have to come to the doctor so that we can offer you a treatment and the right kind of a treatment for your cancer. Sometimes we use a obturator or a denture also when there is a tumor in the um, palate side of the oral cavity. Coming to the voice box surgery, here we have removed the voice box of the person and we have done a food pipe, making it with the flap from the hand. Or sometimes we take a small intestine from the abdomen and we put it in the neck where we do the reconstruction. So that's how we can do a voice box surgery. So at the end of it, the patient looks like this after removing the voice box. And we sometimes put a artificial voice box also. These are the different ways how we put the artificial voice box. This is the patient. Mr. Shah also uses the electrolytic. This patient also uses the electrolytic. So that's how this is the patient is what the esophageal stage. So you can understand these two voice rehabilitation can be done in the patient post larynx surgery. This is the another patient who can use a hand for voicing by closing the TP site and then he's speaking. Huh. And this is the patient who has got a hands-free voice prosthesis. So just wanted to tell you that voice rehabilitation, there are three options are there, but it depends on what you can do it for the patient. So it all depends on the tissue, what is available. So all three patients or four patients are doing very well with their voice. What they have adapted the best for them. So as Mr. Shah also, how he has adapted very well with the electrolarynx and he's speaking so well. So remember, voice is the most important thing. When my patients start talking after I remove their voice box, I feel so happy to hear their voice. It's like mother when she hears first time when the baby says mama, it's like that only to us. So it is really a great pleasure to see our patient doing well. So how to identify this head and neck cancers? So there are many red flags you can see. As I told you, I have showed you these images not to frighten you, but just to make you aware that there are certain things you have to pay attention. That is a red patch, white patch, ulcer, swelling in the throat, or persistent neck swelling or a pain, or anytime bleeding from the mouth or a nose, persistent sore throat or a foreign body sensation in the throat, or difficulty in swallowing, not subsiding with medication for more than 15 days or a 1 month, change of voice, coughing often, noisy breathing, or when you're eating food, you're getting cough again and again, or earache without any ear pathology, or a loss of appetite, or unintentional significant weight loss. These are the red flags. Apart from that, loosening of the teeth, ill-fitting denture, hearing loss, numbness in the tongue, difficulty in opening the jaw, any kind of eye swelling, or any kind of a facial deviation or a palsy, or a black color new skin lesions, which may be a melanoma, or an increase in the size of a skin mole. All these are red flag things. So there are many beliefs. People think that cancer cannot be cured, but no, cancer can be cured if it is detected early. Some people feel that it is contagious disease. No, it is not contagious disease. It is usually happens in old age. I will not get it. That is not the thing. Cancer can arise at any time to anybody without any reason. And the cancer related treatments are very bad for the body. That's what people think, but it is not the thing. The cancer related medication may be the only cure for your cancer, so don't deprive yourself with the treatment. Development of the cancer is related with the amount of the duration of the tobacco consumption, but no, it is not like that. Some people take a small amount of cancer, but the way their body metabolize these carcinogens will be very different. So tobacco consumption and the cancer development is not dependent on the amount. Some people think the supari does not cause a cancer, but yes, supari is one of the isolated carcinogen which can cause a cancer. Smoking is injurious to health of individual. People feel that they are smoking and that's why they are causing cancer or any problems with themselves only, but that is not the thing. It causes problem to the whole family, the surrounding friends, maybe the surrounding people. So that's why we should be aware about our surroundings. The surgery causes disfigurement and cosmetic problems, and alternative or self medication can be tried in the initial period. No, I will say the best treatment options are given according to your stage of a tumor. So the surgery or radiotherapy or chemotherapy is chosen what is best for your cancer. So give a best option to your cancer to be treated. Do not do a self medication or a try doing some treatment by watching some articles or anything yourself. Please give the opportunity to the experts. So, this is one thing I just want to discuss. This is the nicotine addiction cycle. So, whenever person is smoking, he's craving for the cigarettes because of the nicotine, which acts on the receptors, which are nicotine cholinergic receptors. And these are the ones which are giving actually a problem to the patient. And that's why there are mood changes, and that's why people keep smoking. And if you look at this cycle, of the tobacco addiction cycle, early in the morning, after that there is a drop, and then you start getting a withdrawal syndromes symptoms. And that's why the person who is smoking, he keeps continuing smoking. So what is the thing? I will request you that you should quit smoking, because there are lots of benefit. It reduces your heart rate in a few minutes, and carbon monoxide level also drops. The lung starts functioning great, and after a year your heart attack chances lowers, blood pressure comes to normal, and your respiratory system becomes better. After 2 to 5 years, the stroke risk also drops. Up to 5 and 15 years, the cancer risk drops by 50%. By 10 years, the lung cancer, bladder cancer risk also drops by half percent. And by 15 years, the heart risk is same as the never smoker. And after 20 years, head and neck cancer risk is comparable to that of the never smoker. So there are plenty of advantages of quitting the smoking. And as I will say that it is one of the cause which is preventable cause of a death by quitting the smoking. So plan quitting whenever it is necessary for you, and read the reason why you need to quit every day, so that you don't go back to the same circle. Get support from your well wishers. Positive thoughts reinforces the quitting. Avoid accompanying the smoker, and treat yourself. Maybe you may be saving 10,000 rupees per month. Do yoga, do exercises, eat healthy food, use quit lines. Sometime you may use a nicotine replacement therapy with the expert's advice. Attend the tobacco cessation clinics, and please take the expert's opinion and the help to quit the smoking. But you have to decide to quit the smoking. Just wanted to share one study. That is a million deaths study which was done by a Tata hospital leading epidemiological person, Dr. Rajesh Dikshit, that the oral cancer, stomach, and the lungs are the most common and the fatal cancers in males, and the cervical, stomach, and the breast cancers in women. And tobacco related cancers are about 42% in males and 18.3% in women. And there were twice as many deaths from the oral cancer and the lung cancer. So this is the data which was published in one of the main journals. The second thing I want to discuss is the another study where 15 studies are evaluated by the International Head and Neck Cancer Epidemiological Consortium, and what they saw that whenever you use a smoking or alcohol as an addiction, there are chances of having a head and neck cancer 75% of the time, and 25% of head and neck cancer can be preventable if this subjects had not smoked cigarette. The smoking is associated with increased risk of cancer, and there is a close dose response relationship for the frequency, duration, and number of pack years of the cigarette smoking. Even the high frequency of alcohol intake is associated with cancer of the behind the tongue area, or a food pipe area, or a voice box. So just remember these 10,000 patients or patients of head and neck cancer, and the patients who are controlled, they have looked at it, and we know that these two things cause cancer. Let's avoid this addiction so that we can win over the cancer. So, how to reduce the cancer risk? Say no to all these things, and treat your any sharp teeth or a denture issues. Avoid exposure to sun directly so that you can avoid anything sun related or ultraviolet rays related cancers in the lip and the skin. Screen for any abnormal growth in your oral cavity or on the hand, and early detection, and visit to appropriate doctors. Eat healthy food, not processed food. Do regular physical activity. Avoid obesity. Avoid environmental pollutions. Use mask. and good personal hygiene will help you out to reduce the cancer risk. Greetings from Tata Hospital. We have been in Tata Hospital, and Tata Hospital is serving for last 83 years and treating the cancers. We see about 12,000 patients per year as a new cases in our ward. So know your cancer. Cancer is curable if it is detected early. And I want to thank my institute. Whatever I am speaking and whatever I am, it is because of my institute. What institute is offering to our patient, and institute has offered me to learn and understand this cancer. So I would urge you all to treat yourself properly whenever you get any kind of abnormal ulcer in your mouth, and go to the doctor and ask for the advice, and please follow up with your doctor once you are detected also with the cancer, so that you can be cured from the cancer. Thank you very much. I'm here to help you out to see what you cannot see, which you read everywhere, but it doesn't sink in your mind. This is just a cobweb on our mind. We just have to put few raindrops or the knowledge of a raindrops so that you can start seeing the unseen enemy for all of us. And this is one of the Andigam monument in the Lake of Geneva, where this statue is there, where the mandible has been removed because of the dental infection, and that's why the statue. And just to lighten note about the effect of the mandible use, which is very, very valuable for a cosmetic purpose. Thank you very much for your attention. Mr. Shah, I'm done with my presentation. So if anything we discuss, it is open for the discussion.
Thank you. Thank you, Dr. Anuja Madam. Uh, I cannot resist to clap my hands for men delivering kind of an encyclopedia of about head and neck cancer in just 30 minutes. And the garbage figures, when these are quite commendable information you shared today. And today's session is already there on Facebook Live, and in a couple of days we will be sharing with you YouTube link as well. Now, see, I mean, so as a patient ambassador, moderator, counselor, I mean, I'm coming across number of oncologists and cancer survivors, patient caregivers, but uh, two things which I have noticed, which are very important, is second and third hand smoking. I mean, honestly speaking, I was never in last 27, 28 years, I was never aware about that third uh, third hand smoking uh, problems which can occur to the human body. So this is quite remarkable. Now, before I talk further, I have one question. Yesterday, I met someone. I mean, he was having. He was a Lennox patient survivor, and just to preserve his voice, he was given radiotherapy, and voice was preserved 2 years later. So recently, he is diagnosed with the recurrent larynx cancer, and now uh, he has seen oncologist, and he was advised, like, we will try to perform a surgery, but we are not sure. We will try to preserve your vocal cord, but not sure we may have to opt for a total laryngectomy as well. So, what do you think the ideal approach should be? I mean, of course, the situation can be decided only on the operation table, but according to your experience, what should be the best option? Is it a total laryngectomy or still continuing with a kind of some surgery, then preserving the voice and wait for the future? So I would like to have your opinion, please.
Really a nice question and a thoughtful question about the voice box surgery. What should be the voice box surgery? And whether there is any role you can save your voice and give radiation so that you can avoid the voice box surgery. It's an excellent question. So let me tell you. So if you have a fly, you can hit it with a small thing or you can hit it with the bullet. So at the end of it, the aim is to kill the fly. In the same way, it happens for the cancer also. So you have a voice box cancer. If you have it in the stage one versus you have it in the stage four, for example. So in stage one, you have an option that you can do a small laser surgery or a small surgery and you can get out the cancer and the patient's voice box is also there and the cancer is also there. So you can do a laser surgery, you can do a radiotherapy, and you can cure the cancer because it is in initial stage. But as the cancer increases to stage 3 and 4, it becomes very difficult. So in stage 3, we might try doing a chemotherapy along with the radiotherapy, provided that cancer is amenable for that kind of a treatment. Okay. So we see certain factors on a CT scan, certain factors after doing endoscopy, after examining the patient, and then we decide what is appropriate for that stage. And that's how we can preserve their voice box. But suppose this patient is in a stage 4 cancer, his voice box is not functioning, and the best treatment for him is to undergo a voice box surgery by removing a voice box. In that situation, if you do any other treatment, which is a less treatment, your cancer will not get cured. The cancer will still remain there, and then you will use that modality also, and then you will finally land up doing a surgery again for the voice box. I totally understand voice box is very important to everyone. It is everyone's should have their voice box with you. But sometimes, if you don't have an option, your best option is removing the voice box. Go and after you go for it, you will be cured for cancer to conquer the world. Okay, and you have a different option, as I said, that how you have adopted the electrolarynx, or you can do an esophageal speech, or you can have a prosthesis, as I showed how they are talking. So voice box is out does not means that you're out. You are actually in, so that you can actually fight with the cancer in a better way. So today I had seen a patient in my OPD. I asked him and I said, you have an option about keeping your voice box and treating you with the radiotherapy and chemo. So patient said, Madam, do anything. I'm ready to lose my voice box also, but I want to live for my family. I want to live for my son. So I was appreciating him and I said, I'm really thankful to you by coming it from the patient that I am ready to do a voice box surgery and I am saying I will try to preserve your voice. It is just amazing how people are and how they react to their cancer diagnosis. It's very important to understand it. And I think this is more than enough to believe in what your doctor is offering you and understand your doctor and try to do a justice to your cancer so that you will be cured. I feel that I answer your all the questions.
Absolutely, and trust me, Dr. Madam, that I had I took, we, rather me and my wife, we took collective decision back in 27 years, back in, yeah, 1997 to all for total topic instead of trying something here and there. And fortunately, that is why I am sitting in front of you. And you know fortunately, Dr. Gautam Patel is my savior, and that's how I'm getting live as a speaker and whatnot. And trust me, this is, I mean, look, I really have no medical background at all. I do understand the importance of the voice, importance of the speaking, but then, you know, I mean, if we are using smartphone, but if we are not smart enough to take smart decision or an intelligent decision, that means, I mean, it is of no use. So I said same thing to that patient yesterday, that you have to take collective decision, like whether you want life or voice, and then you need to be smart and take the appropriate decision. So thank you very much for this appropriate advice. And what I will do is, like I will share this today's conversation with that patient and caregivers, and let them decide what is best to be done. Now, a couple of more things are like, but I mean, still pertaining to CNNX of late, or rather in last 5-10 years, I have seen they approach uh, by ethnic surgeon, particularly for Cylenics, that they try to preserve the voice, and then by provide giving radiotherapy, chemotherapy, and so on. But if I mean whatever I have seen or other I have come across, the people that in most of the cases, recurrent cancer has occurred to all those individuals. I mean, whereas after opted for radiotherapy, chemotherapy, and then situation is becoming more and more worse. So yeah, is it not ideal approach to opt for total laryngectomy instead of preserving the voice? This is my major concern.
Yeah, I mean, I can say it that all tumors are not same. All tumors will not react to the radiation and chemotherapy same way. And all cancer needs to be selected properly before you offer the treatment. Yes, we are able to give them a chance of preserving their voice boxes. And sometime, if we cannot save their voice boxes, there is still a backup option of doing a voice box removal surgery in a later date, and then accepting it and getting cured from the cancer. So you have all the options, and there are different kind of modalities that are still available. If I say that the radiation and the chemotherapy has changed over a period of the times, last 10 years, 20 years, so we can offer a better treatment modality. So as I say that if it is a small tumor, don't need to sacrifice. But if it is a big tumor, and if you accept it, then maybe voice box surgery will be the best thing. Because after voice box surgery, also, if it is in an advanced stage, you might require again a radiotherapy and chemotherapy to control your cancer. Surgery is not the only way of doing it. So it is a multi kind of a treatment modality. So it all depends on what stage, what is your final report after the surgery. So if I see a report after 10 days or 12 days, when the report comes in with high risk factors that your tumor can come back, then I will do a voice box surgery. Then I will give you a radiotherapy and small form of a chemotherapy so that your cancer is cured and cancer does not come back. So what is the sequence of the treatment, that all depends on what is your cancer. So there are many things we look at it. We look at whether the, first of all, that voice box is functioning or no. when the cancer is there. If voice box is not functioning because cancer has eaten up into the cartilage, there is no point in preserving that voice box. So you have to understand that we can only preserve those voice boxes which are small and which are in a position to be saved for the patient for the good ones. If it is not in that position, then it is better to take it off, and um, we should accept yourself that you want to go ahead and do it. And the whole journey is accepting what you're going to lose and what you're going to gain out of it. That you need to
Absolutely. Thank you. Madam, now coming to the usage of tobacco. Yes, we are all familiar with the various type of cancer because of using tobacco and smoking and other stuffs. But what happens is, this addiction is so bad that, no matter what, people get prompted for one reason or the other. And I believe uh, uh, Tata Memorial and many other organizations, they should rather do connective efforts because say one thing is certain, whether you are using smoker, whether you are smoking, using tobacco, hookah, whatever, when you are going to diagnose with the cancer, no manufacturer of safari, smoker, cigarette, etc. is going to help you out with your cancer treatment. That means you are gambling your own life, and on top of that, you are penalizing uh, your family, spouse, children for that no fault of theirs. So I think this, I mean, ideally, there should not be one day of, no tobacco day, that is 30%. It should be 365 days of no tobacco day. And that is the ideal approach. Which I need, let's check if anybody would like to ask any questions.
Yes, sir. I also have a question, ma'am. I'll check Facebook after that only. So, मैम जैसे कि आपने मेंशन किया था आपकी टॉक में अबाउट एनवायरमेंटल फैक्टर्स कि हमें हाइजीनिक एनवायरनमेंट में रहना चाहिए। तो अब जैसे कि हम लोग दिल्ली में रहते हैं, यहाँ पे तो सब लोग जानते ही हैं कितना ज्यादा पॉल्यूशन के लिए फेमस है दिल्ली। तो मैम हम लोग क्या कर सकते हैं, एज इन की पूरे टाइम हम लोग मास्क में भी नहीं रह सकते हैं। सो अलग चीजें हम लोग क्या कर सकते हैं इस चीज से।
so, as I said, environmental factors play the role. So the environmental factors can be many things. Like you can have a dust, the wood dust. You can have a some chemical dust, maybe asbestos, or you can have something in the pollutants coming in the because of the vehicles, the badly maintained vehicles, and throwing the smoke in the air, or the factories which are releasing the bad fumes in the environment. All these factors can cause a cancer, a different type of a cancer. And as you are in close proximity and duration you are exposed to this carcinogen, your body will react to it. So as we have come from COVID era now, I think we all know that wherever there is a pollution, we have a mask in our bag and we just cover it, and it just helps you not to inhale this. Okay, so apart from that, like if you're doing a woodwork, the woodworkers also get some kind of a cancer just because that wood dust goes into their nose and all that. So if they just simply use a mask which can just prevent it. So we are come long way in a COVID era, and the mask we can use it outside, and when you come inside your offices, or if you come to your home area or a garden area where you can remove the mask and breathe the fresh air. So any polluted area, you smell it, you know that it is there in the air, so just avoid that much, and that may help in some way or the other. That's what I can say it. And that is it about from the environmental factors.
Okay, ma'am. Thank you.
Thank you.
Recently somebody asked about the thyroid cancer, if it is falling under urinary cancer, which I said yes. So I mean, you can ask the person to inquire or whatever her query is.
So, actually, in my talk, I did not put the thyroid cancer because thyroid cancer altogether is a different cancer, and it can cause because of various reasons. And it has been because we have a sonography very easily available nowadays. We are detecting also early. So, if I can say it about thyroid cancer, thyroid cancer is easily diagnosable. If you can treat it nicely, you can achieve a good survival also. So it is a good cancer. But in among thyroid cancer also there are two cancers which are bad cancers. So we have to identify that bad thyroid cancer from the good thyroid cancers and treat it aggressively. And even thyroid cancer can cause lots of death if they are in a bad thyroid category. If they are good, then good surgery and they will be all good for very long. So that is.
Well, I cannot find out the name of the person who has asked this question through iPhone. But let me tell you, Dr. Anuja Deshmukh, madam, she is the one of the best cancer surgeon for thyroid cancer. So feel free to reach out to her. And by any chance, if you need any help, feel free to reach out to me, and I will be more than happy to get you connected with Dr. Anuja, madam.
One more thing, what you was talking about the quitting for the any kind of addiction, what you were discussing before. So as I will tell you, whenever when I was in a school, just outside my school classroom, there used to be one कविता गाना, कल करे सो आज करे सो अब करे, so क्षण में प्रलय हो. So if you want to quit tobacco, you have to decide the there may be one trigger which will make you to decide that you want to quit. 85% of the patient they want to quit, but because of that addiction, what nicotine causes you keep going back of that cigarette or keep going back to that addiction. So what you need is you require a help from everyone, help from all 360 degrees. You can take help from your friend, you can take help from your baby, you can take help from your sister or anybody just to get your support, psychological support. What is required? Take a help from a preventive oncology department. Take a help from the quit line. They will guide you. Take a help in a drug form, maybe some kind of a medication which will help you to sail through the withdrawal symptoms so that you don't go back, or go to a tobacco cessation programs where they will help you officially with the drugs and the tablets so that you can quit. But at the end of it, it is in mind. You have to decide that you want to quit. Nobody else is going to help. If you suffer from cancer, you are the only one who is going to suffer. It is not the other people. And if you benefit by quitting, you are the one who is going to get benefit out of it. So I will suggest quitting is a process for which you require help from all the angles so that you go to the success.
Question that is question uh, from the same person. Please read out for madam.
Doctor, there is a question in chat box from Dinesh Kumar. Is NGS becoming part of treatment? how important it is to get right treatment, namely chemo targeted
We are
therapy.
So, Mr. Dinesh, what you are asking is very, very pertinent question that nowadays many doctors ask for NGS report and they want to treat depending on the NGS report or targeting that mutation particularly and giving a chemotherapy according to that. So, if I can say in head and neck, we don't do so much of NGS. We do a NGS many times in the lung cancer and all that. It is very much used. So there are lots of evidences. If I can say, lots of paper has been used where they use this NGS reports and they give it according to that. And coming to when you use NGS, usually it is used in the stage when there is a advanced cancers and all. When you pick up the cancer in an early stage, the standard treatments are surgery, radiation, chemotherapy, initial period, which are very, very standardized, where you don't require so much of NGS to be done. But yes, as I said, as we advance in the medical field, we will have more of these NGS reports in our um, in a treatment algorithm, and we will use it so that we can personalize and give the treatment to that particular tumor which is showing particular mutation, and we can target that. But yes, it is being used, but not so much in head and neck. So head and neck also it is coming up with some kind of a NGS directed treatment in a bad cancers where we don't have much time to treat it, and if we know the mutation we can just target it. And the another story is like, if we know NGS mutation, but we may not have that particular drug in India. Maybe it may will still come to India. Maybe it is available outside. So it can be on a trial basis. It may be not on a regular basis also. So doing NGS is one part. Using that information is another part. The third part is, do you have a drug to target it or not? So there are two, three different things about it. But yes, you do have that option in the treatment algorithm. I hope, Mr. Dinesh, it answers your question.
Yes, ma'am. I guess it is nicely answered. And ma'am, there is another question from iPhone. Someone is asking how the follow-up of the thyroid cancer is done.
So, thyroid cancer is as I said, there are different type of a thyroid cancers. So one is called as a differentiated thyroid cancer. One is mainly the medullary thyroid cancer. And another one is poorly differentiated or anaplastic thyroid. I'm not going to go into the anaplastic or poorly thyroid cancer because they are bad thyroid cancers. So their treatments are very short time where you have to treat it very aggressively and all that. I'm not going into all that. But coming to the follow-up of in general as a thyroid cancer, if I can say it, every 3 to 6 monthly, what we do is a thyroid function test of the patient. We check thyroid globulin levels of the patient if they are adequately treated, and then we accordingly uh, give the thyroid replacement treatment for this patient. Sometimes they have a calcium deficiency post surgery, so we give them calcium tablets. Sometimes they have vitamin D3 deficiency, so we treat that. So thyroid cancer follow is usually 3 months initially, then 6 months, then slowly it goes on every yearly or 2 yearly. As patient is all right, and as I said, it is a good cancer. So when it's in a good book, you can just follow it up after 1 yearly or 6 monthly, or as you progress, then you can do it after 2 yearly or even after 2 yearly also later on. But if it is a bad cancer, then you need to see doctor more often, like three monthly. Or if it is a medullary thyroid cancer, the treatment algorithm is totally different for that thyroid cancer. So that again becomes a 3 monthly, 6 monthly, depending on how the values are. So it's all depend. Your doctor will guide you what kind of a follow-up to do. So you are not the one who is going to decide when you're going to follow up. Your cancer, your treatment, your doctor is going to decide how you're going to follow up. But at the same time, you have to choose the best option so that you see somebody somewhere so that your cancer is not neglected. Okay.
Uh, Madam, actually, to some extent, uh, I'm familiar with the rather I would say the fear about recurrent cancer of the thyroid. So what happens is, I mean, apart from clinical test and everything, there is always a fear in back of mind about recurrent cancer, particularly in I mean, about thyroid, and that is rather taking a toll of the patient or toll of the survivor, because oncology is not always there. So there is always a fear going back in the mind, like I mean, am I having a recurrent cancer or not? So that is what the major concern is.
So I will tell you something. The story is like when you have a cancer, which is a good cancer, the doctor has cured you, but your mind is not settled. Mind is not cured because that trauma of cancer is too much for everyone to accept or not to accept. So, though the cancer is good, the doctor has treated you well, it is there in your mind that, that am I going to get the cancer back? That is always a fear for it. So, as I said, that when you cure, then you are worried about the cancer. But there are people who have an aggressive cancer and where they should be worried about the getting the recurrences. So that doesn't happen. So as I will say about the thyroid cancer, uh, there are studies which are done in Japan, and these are the big studies where when you have a tumor, which is a very very small tumor of a thyroid, you can keep it in your body and you can observe it without treating also. So what we call it as active surveillance, provided that cancer is very small and you are ready to follow up with that cancer in your body. But you can understand the patient will have so much of psychological effect of it. Some people accept it, some people cannot accept. But that's the point, just to tell you that when you don't have a cancer, the fear from the mind cannot be taken out by anyone. Okay, so you have to remember that thyroid cancer is a good cancer. If it comes back also, you will have a treatment to offer you and you will be treated for it. And you can do a sonography, thyroglobulin, anti-thyroglobulin, simple test, CT scan, you will know that it has come back or not. And you will be able to offer the treatment if you are in a regular course. If you visit the doctor once in this year and after 5 years, if you're going, then it is not going to help you out. So if you get recurrences also, they will be, you can check it out that it is in a smaller stage and you can. So always treat yourself with a regular follow-up as it has been advised by your doctor. You will be and trust your doctor without any doubt. You will be able to sleep in the night well without having a fear in your mind.
Thank you. So, Madam, on behalf of you, I would like to specifically or rather categorically mention to that particular person that stay in touch with Dr. Anuja Madam, and don't worry, Lord Krishna is going to support you all the way, and there are good doctors, including Dr. Anuja Madam. Get in touch, and don't worry, everything will be fine.
I can't believe that you came into my life.
You don't
Uh,
have to
You
go
made
to
me
any
feel again. Now
your doctor and just understand and follow your cancer how it should be followed up. You will go out.
Madam, I mentioned about your name because you were kind enough to see her a few months back on a very priority basis. Therefore, I mean, she's rather more convinced, for future treatment and follow-ups. I think this is all question. Is there any new questions?
Yes, sir. There is one more question from Mrs. Ranjit Kaur. She's saying that is there any way to help someone for quitting smoking or chewing tobacco?
Um, Mrs. Kaur, I'm just, I think, answered just before a few minutes back. But if I can tell it in a short, maybe you were not there around that time. So, quitting is required for a person, and it helps a lot for that patient and even for the family. So, you can stop addiction. That is the first thing. The second thing is you can take a help from the quit lines, or you can go and visit the preventive oncology departments. We do have it in one in Tata Hospital, or you can attend something called as an expert who help you to quit. I mean somebody who is trained into that, like a tobacco cessation clinics, what we have it in Tata Hospital, or any other big hospital where there is an oncological unit. They will have the quit programs, and you can visit them. They will help you in an expert way, in a medical form also, giving tablets so that it helps you bodily not craving for the nicotine, and help to stop the drugs, and just quit the habit. And it will help you in the long run to avoid lots of side effects of the tobacco.
Uh, I think just one last question. I mean, on behalf of that thyroid cancer survivor, I mean, having follicular thyroid cancer, I mean, what should be the duration of the follow-up required?
So, follicular thyroid cancer used to be very, very common earlier days, but after the iodine has been added up to the food, the, the follicular carcinoma numbers has changed. But what we see nowadays is a follicular variant of the papillary nowadays, or a papillary thyroid cancer nowadays. So coming back to the follicular thyroid cancer follow, so the what we do usually is if we do a total thyroidectomy for this patient, the whole thyroid is out from the body. So we need to replace that thyroid hormone for that patient life. And what we do immediately after the surgery is this patient has been kept on an iodine-free diet. And we give a radio iodine to this patient, and we treat any small traces of cancer in his whole body by giving him radio iodine treatment, where what he has to take it orally, means he has to take it by mouth. And this dose he will take once after the surgery, after stopping the iodine all that. And then they will check it out that whether it requires a second dose or not. And depending on your body, your tumor type and everything, they will decide you require one dose, two dose, three dose, four dose, depends on that. And depend on that, they will space it out by 6 monthly or 1 yearly. So this first, second, third dose will be given as a yearly or 6 monthly, depending on what your cancer requires. So suppose you require only one dose. So after that, it is only titration of your thyroid hormones. That whatever dose you are taking, is it appropriate for your body or not? So we do a thyroid function test. We do a thyroglobulin just to check. That's basically a representation of if any thyroid cells are increasing in your body. And we do a thyroglobulin, antithyroglobulin, UPS test, and check out whether the tumor is growing. We sometimes do a sonography of the neck and check any tumor in the neck is growing again. If somebody comes with the backache or anything, Then we will do a CT scan of that and we detect a tumor has been spread to the bone or not. In follicular, very likely that is the thing. Sometimes the patient might come with the bony swelling and then thyroid has been detected incidentally. And then we know the tumor in the bone is because of the thyroid. So we treat only the thyroid and we give the radioiodine or radiotherapy to that bony layer. So it depends what stage you are, where is the tumor has spread. Depends on that we do the most important thing about the thyroid cancer is if it is spread to the body also, sometimes we can give a good life to the patient. So it is not all over. So thyroid cancer, when it is spread to the body also, still we treat the cancer with a great intent to give a good longevity. I have a one patient who is a doctor by occupation, who is a general practitioner. He first time came with a bone metastasis and thyroid swelling. And I did the surgery and he's doing well. It's been, I think, about 10 to 12 years. He's doing well. He sometimes sends me his photo on his birthday, and I'm very happy to see him on his birthday. And he's doing well. So I'm very thankful to him that he always update me with his how he has recovered when the tumor has spread to his bone. He took radiotherapy, and whenever he go and pray to the God, he always tells me I went and prayed to the God. God is still in Kolhapur, and I did this and all that, and he sends me the photo at the same time. So I'm very happy when the patients share their thoughts about the things. And also, if I can tell you that one of my patient has written a book who is a thyroid survivor. It is different that she has looked at the cancer in a different way, in a good way. All patients' cancers are not good. What we see here are the different cancers what we see. Some and any cancer can be even in thyroid can be bad because they can get a change of voice. They may have to take a lifelong calcium. But with our experience, we can give a patient a good voice in spite of treating the cancer, and we can give them a life without having popping up the calcium tablet all the time. So there are different technique what we use with the thyroid cancer. If I can suggest that each cancer, each surgery, smallest of the thyroid surgery or smallest of the cancer surgery is big for that patient. Any big surgery for even for us is big for the patient also. So thyroid cancer is a different cancer.
Thank you very much, madam, for answering all questions adequately. And I must mention to the entire audience and whoever is going to listen this recording later on that try to stick to your oncologist. And I mean, if you are not a medical professional, don't try anything by yourself. I mean, it is going to be most dangerous situation. Which only is there anything pending now, or we wrap up now?
No, sir, we are good.
Great. Dr. Anuja Madam, thank you very much. And yes, it is my commitment next time whenever I'm going to be in Mumbai, I would love to meet you. Yes, I will certainly let you know in advance. And by any chance, if you are coming to Ahmedabad, be my guest. Thank you very much for your most valued time and delivering the encyclopedia of head and neck cancer in just 1 hour. Thank you so very much.
So thank you very much, Mr. Actually, it was your words, and because of that, I'm here. And it has been this happy to be giving a talk on a very topic. It's my duty to just spread the knowledge what I know so that even one person also get benefited out of this talk, looking at this picture and it is good treating the tobacco, helping in going to the doctor early in a stage, and if he gets cured, my whole purpose of this is to do that. So greetings from Tata Hospital and my institute, my place from where I come from, and I request everyone to treat yourself as a king or the queen and get a medical help early in your uh, journey of cancer if you have it. And if you don't have it, don't despair any time.
Thank you so much, ma'am, for your valuable time and the session. Thank you, ma'am.